My name is Dr. Keely Boyle with UBMD Orthopaedics and Sports Medicine. I am a hip and knee replacement surgeon, and UBMD Orthopaedics and Sports Medicine, in partnership with Niagara Falls Memorial Medical Center, are launching a hip and knee replacement program. Is there a problem with waiting too long before deciding to have your hip or knee replaced? This is another common question that we see all the time in our offices. People with hip and knee arthritis have disability from two things: pain and mechanical symptoms, such as locking of your joint. Some people suffer from pain, swelling, and stiffness for years before considering surgery. Other people see a doctor when mechanical symptoms occur, such as buckling, clicking, grinding, or limping. And when these things get worse, they finally go in to see their doctor. These symptoms can jeopardize safety at home or even work. As hip and knee arthritis worsens, the stiffness of the arthritic joint also worsens. So sometimes you'll see, if you have really bad knee arthritis, that your leg doesn't straighten out all the way, or your knee doesn't straighten out all the way, and you have to walk with a bent knee on one side or both sides. This sometimes can make replacement surgery more difficult. Also, sometimes you'll see people that are very bow-legged, or sometimes are knock-kneed, and they also can have really bad arthritis. And sometimes if those people become too bow-legged or too knock-kneed, it can make the surgery more difficult for us. This may mean a longer recovery and more physical therapy. And sometimes, unfortunately, in severe cases, joint flexibility may never return to normal. By waiting too long, you may not get the full benefits of your hip or knee replacement surgery. We recommend giving Dr. Nadzo and myself a call through UBMD Orthopaedics and Sports Medicine and Niagara Falls Memorial Medical Center to make an appointment with us to discuss your hip or knee pain and how we can help. And we can help not only with surgery, but we can help while you're trying to decide whether a joint replacement is right for you and your loved ones who will be helping taking care of you after the surgery. Our number is 716-204-3200.